Okay, so I think we'll get started now. Thanks for joining us. So I'm just to let you know, I'm recording the first part of the meeting where I'm going to present the guidance notes and take some questions, and then I will go offline and Fiona Keogh, who was the chair of the the chair of the National Mental Health Research Strategy Expert Group, she will then facilitate a discussion among you as a community, and we won't record that part of today's session. So, and I'll be sharing the slides as well as the recording. So I'll just jump in and actually, Fiona, before we start, are you able to admit people, or do they pop up when people try to come in, or no? I think you're on mute, Fiona, sorry.
Sorry, yes, they do, Camille. Do you want me to admit people while they're popping up? Yeah.
Yes, that
While
would
you're
be great
speaking.
if you
Yeah.
could do that. Thanks so much, Fiona. Thank you. Great. Um, Yes, so I'm going to take you through the guidance notes and the details for our call and the Health Research Board for a collaborative research network for mental health. And just by way of background, in the Health Research Board, our vision is for better health through excellent research, data, and evidence. And our mission is to support research that improves people's health, promotes evidence-informed care, and importantly, creates solutions to societal challenges. And we're the leading funder of health and social care research in Ireland. And in terms of our collaborative research networks calls, we've funded several before, and through these research networks, we support networks that enhance capacity, collaboration, and impact by connecting researchers, knowledge users, and importantly, people with lived experience. And the aim of collaborative research networks is really to promote and advance research in a particular thematic area, in this case, mental health, and then to ensure its application in policy and practice. So the call is for a 5-year grant for €1 million, which is inclusive of overhead. So this would be the first iteration of the Collaborative Research Network in mental health. And really, we want the network activities to lead to transformative change in the area of mental health research by focusing on collaboration with a wide range of actors, including researchers, community and volunteer organizations, which play a particularly important role in the mental health field, knowledge users, including policymakers and practitioners, people with lived experience, peer researchers, also who play a very important role in mental health, and then the international community as well. So I'm going to take you through the objectives of the Collaborative Research Network for Mental Health as we lay them out in the guidance notes for the scheme, which are available on our website. So this award will provide funding, so €1 million, as I said, to establish a single collaborative research network in mental health. And this is really crucial. The identity of the network will be separate from any individual institution and serving all institutions across the island of Ireland. And it needs to be designed to ensure a visible, transparent, and ongoing process for bringing in new members through the lifetime of the network, in this case, the first 5 years of the network. And we want these members to represent all key actors in mental health research and policy across the island of Ireland. So the network should also address challenges in research integration, in collaborative capacity building, and in knowledge translation in mental health research. And we really want the network to create a robust foundation for impactful mental health research that informs service improvement and policy development. The network needs to represent and connect relevant stakeholders across the island of Ireland. As I've said, the intention is this is an all-island network, and we want to ensure meaningful involvement of people with experience at all levels of the network. And this is to align with the core principles in the National Mental Health Research Strategy of co-production and collaboration, which are two of the key pillars of the mental health research strategy. The network should also identify and address challenges in conducting and applying mental health research, so broadly challenges in these areas, and then build capacity for research and the use of research evidence in policy and service delivery. Now, it's really important to emphasize that the network should facilitate multidisciplinary collaboration across fields of research, across service delivery models, and across policy contexts to drive impactful system-wide improvements. And this is because mental health is particularly multi-sectoral in its nature. So it's really important that multiple sectors are represented in the network and multiple fields of research are represented in the network. And early career researchers are a really crucial part of the researcher pipeline. So we want the network to engage, support, and enable early career researchers and ensure that the network provides a structured pathway for training, mentorship, and participation in mental health research for these early career researchers. Co-production, as I said, is a key pillar of the mental health research strategy. So beyond the fact that people's lived experience should be meaningfully involved in the network structure itself, the activities of the network also should foster a culture of co-production throughout mental health research as a field, so that research is designed, conducted, and applied in partnership with people lived experience, but also with knowledge users, including voluntary and community organizations and mental health service providers. And then finally, the last two objectives of the network would be to communicate and disseminate research findings widely to engage policymakers, practitioners, community organizations, and the broader public in mental health research, and to ensure that the network activities contribute directly to implementing strategies related to mental health policy, mental health research, and service developments across the island of Ireland. So I want to emphasize here that this is a long list of objectives, and the intention is not that all of these objectives should be achieved in the first 5 years of the network, but these are the objectives of the network overall during its lifetime. So it would be up to you as a community, as the leadership team and the applicant team work together to develop an application to decide which of these objectives would be the priorities in the first 5 years. And of course, like developing a governance structure and developing a way of bringing in new members of the network would be one of the first objectives. So the call for this collaborative research network in mental health comes directly out of our national mental health research strategy in Ireland, which was published in December. And the activities of the network should align with the mental health research strategy. So the network should work to address the research priority areas that are set out in the National Mental Health Research Strategy. There are 15 research priority areas that are laid out, and they align with the 4 key domains of the Sharing the Vision mental health policy. And the network should also promote and support the key pillars of mental health research as they're laid out in the Mental Health Research Strategy. So the strategy clarifies 4 key pillars of mental health research, including infrastructure, capacity, co-production, and collaboration. And the first recommended action under the collaboration pillar is the establishment of this network in mental health research. So ultimately, one of the key aims of the National Mental Health Research Strategy is to increase the impact of mental health research. And we want the network's activities to also really focus on that. And as I said throughout the objectives, a key priority for the network is having research influence policy and practice. So in terms of the applicant team for the application for the network would be managed by a leadership team, which will have up to 3 members in total. So one would be the lead applicant, and then there can be 1 to 2 co-leads. So each of the members of the leadership team, so the 2 to 3 members of the leadership team, would hold equal responsibility for the management of the network. It's important to note that the lead applicant will serve as the primary point of contact for the HRB and will have primary fiduciary responsibility for the network. However, as I said, the leadership team, which would be 2 to 3 people, will have equal responsibility for the running of the network. And then, as we clarify in our guidance notes, which, as I said, are available on our website, co-applicants and collaborators would be named in the application, and we expect that a broad range of co-applicants and collaborators are included. And we want these to represent knowledge users in policy and practice, members of the voluntary and community sector, and people with lived experience, among others. In terms of co-applicants, to be a co-applicant, and this is all laid out in the guidance notes, a co-applicant must have a well-defined, critical, and substantial role in the delivery and steering of the proposed network. And co-applicants are asked to select whether they are a co-applicant researcher, a knowledge user, a PPI or lived experience contributor, or other, which can be defined. And we really would expect there to be several co-applicants within each of the researcher, knowledge user, and PPI lived experience categories. And that could also be, knowledge user can be, I should say, policymaker, practitioner, or community and voluntary sector organization. A collaborator is an individual organization who has an integral and discrete role in the proposed network. And an individual organization should really only be named as a collaborator if they provide specific contributions, either direct or indirect, to the network's activity. So their naming as a collaborator needs to be meaningful. And the contributions could be training, specialist staff time, staff placements, or a collaborator could act in an advisory capacity. So I want to emphasize that the network really needs to be multi-institutional. So the membership of the applicant team and the leadership team should be multi-institutional. And this is an eligibility requirement for the call. And given the expected all-island nature of the network, geographic coverage is very important in the applicant team, both in terms of including applicants or co-applicants from Northern Ireland, but also geographic representation across the island of Ireland overall. So within the Republic of Ireland, we want to see people represented from multiple counties and regions. And co-applicants and collaborators from outside the Republic of Ireland and Northern Ireland are welcome. So the host institution, in HRB, we define a host institution as a research performing organization that's approved by the HRB, by us, for the purpose of receiving and administering HRB grant funding. And the host institution for the award is normally that of the lead applicant, but it can be another organization or institution designated by the research team. It still has to be a host institution approved by the HRB. It really has to be clearly justified if the host institution is a different organization than that of the lead applicant. And for this award, only host institutions in the Republic of Ireland are eligible to apply. However, as I said, co-applicants and collaborators from Northern Ireland are welcome. And the co-leads can also be from Northern Ireland if they're from HRB approved host institutions in Northern Ireland. So in terms of next steps, I'm going to share a recording of this first part of the webinar. I'm going to take questions after this before I go offline, but I'll share a recording of this first part of the webinar along with the questions and answers session with me. And hopefully you already know, and I've said it by email, that if anyone is interested in playing a role in the application as a named person, organization, please email me and I'll connect you with others. So I have a shared document listing everyone who is interested in playing a role, where you can provide your title, your organization or institution, and the role that you might be interested in. So whether it's co-lead, leads, collaborator, or co-applicant. And from this point forward, so after this webinar, it'll really be up to you as a community to progress the application process. We held a webinar in December which served as a pre-call announcement. And then in early February, some of you attended an in-person event. We held a day-long event leading up to the launch of the call. The call was launched on March 3rd. And then you can see here the call will close on the 30th of May. So between now and the 30th of May, it's really up to you as a community to come together to work together throughout the application process. And as I said, kindly Fiona Keogh has offered to facilitate the rest of this call. But moving forward, it'd be up to you to set up your own calls to move the application forward. And then just in terms of the way it'll go for the rest of the application and review process. So this is a single stage application process. So we'll have a panel review. So we'll have a public reviewers, written public reviews. This is our kind of PPI public review process where members of the public have an opportunity to write a written review of the PPI and lived experience element of an application. So we'll have 3 public reviewers, and there'll be an opportunity for the applicant team to respond to those public reviews in August. And then in mid-September, we'll have our panel review meeting. And then the recommendation will go to our board, HRB's board, in the end of September. And the successful application will be alerted in early October. We'll have contracting process for the grant in October, November. And then the start date would be December 2025 for the formal start date and the funding to begin for the grant. So I just wanted to take you through, I mean, the guidance notes they're available to everyone on our website. They're very detailed, so I thought it would be valuable to take you through them today. This is my email. Anyone is welcome to reach out to me with any questions. particularly, as I said, if you're interested in being added to the list I have of everyone who's interested in playing a role in the application process. And that list is being then shared with everyone who has come forward to be named so that you can move forward as a community. And for anyone who's interested in being involved in the network once it's established, but doesn't necessarily want to be involved in the application process, please email me as well, because I have a separate list of people for that, where that I can then hand over to the network once it's established.